Today we are going to discuss about ventricular fibrillation, a shockable ECG rhythm. We'll see what is ventricular fibrillation, looks like, why it happens, and most important, how to respond in an emergency. Welcome back to our ECG Tech. If you found this video helpful, please like, share and subscribe to get more updates from this channel. What is ventricular fibrillation? It's a life-threatening cardiac arrhythmia where ventricle quiver instead of contracting effectively. There is no depolarization occurs over here. No depolarization of the ventricle occurs over here. It leads to no cardiac output. Also, blood will not pump to all the vital organs of the body. It's the main cause of sudden cardiac arrest. Look at the ECG here. Is there any rhythm? There is no specific rhythm can occur. Why? There is no atrial activity in the ventricle also. Only quivering of the ventricle occurs. There is no ventricular activities. Only quivering of the ventricle occurs. Due to that, some fibrillatory waves can be seen over here. There is no P wave. Due to that, there is no PR interval. There is no QRS complex. Also, there is no T wave. Only fibrillatory waves can be seen in these patients. There are two types of ventricular fibrillation, coarse ventricular fibrillation and fine ventricular fibrillation. In coarse ventricular fibrillation, what is there? Look at the ECG here. There's a large fibrillatory waves can be seen. It's more than 3 mm amplitude. It's the early stage of VF. Better chance of early defibrillation. That means early survival can occur in coarse VF. So here there is fibrillatory waves are large, that means it's more than 3 mm and it occurs in early stage of VF. So there is a better chance of survival rates are there in coarse VF. One type of VF is fine VF. As you can see over here, it looks like a systole, right? So it's difficult to distinguish from a systole. Here the amplitude of the waves are smaller. It's the later stage of VF it occurs. So there is lower chance of successful defibrillation. So the chance of survival is less in fine VF. Now we will see what are the causes. Coronary artery disease, mainly heart attack. That's a cause for quivering of the heart and there is fibrillatory waves occurs over there. Also there is electrolyte imbalance, high and low potassium, high and low magnesium also VF can occur. Also in drug toxicity, overdose of the drugs, certain drugs and in severe heart failure. Hypoxia also is a cause for VF. And also some of the disease conditions related to the respiratory tract also can cause VF. Now we will see what are the signs and symptoms. There is a sudden collapse of the patient, no pulse, no breathing and loss of consciousness. These are the signs and symptoms. When you call the patient, there is no conscious level, unconscious, and there is no breathing, no pulse, and there is a sudden collapse. These are the signs and symptoms in VF. Now we will see what are the treatment. Activate emergency response system immediately. Follow ACLS algorithm. Start CPR, early defibrillation. The drugs used over here is epinephrine and in a later stage amiodarone or lidocaine can be used. Also secure the airway. These are the treatment and follow the ACLS algorithm. Thank you for watching and stay informed and stay prepared. I will see you in the next video. Subscribe to Alice Edutech.